Hello, my name is Joseph. I'm going to be your trainer on this training course, Food Allergen and Intolerance Level 2. Now, how many modules are we going to cover in this training course? There will be 5 modules. Make sure you cover all of them, and at the end of all the modules, there will be an end assessment that you need to make sure that you pass. Now, the modules will be that we're going to cover are: number 1, effect that allergens have in the body; number 2, the rules for allergens information; number 3, providing accurate allergen information for prepacked and non-prepacked food; and number 4, managing allergens in a catering environment. If you work in a catering environment, how do you manage your allergen information? And the last one will be the use of voluntary labeling. Now, why this course? This training is very important to manage allergens effectively in your food business, to ensure food is safe for your customers that have food allergies. Now, this involves including allergen information when menu planning and having good food preparation and hygiene practices in place to avoid cross contamination in your food preparation area. Now, keeping your staff trained about food safety is very important to a well-run catering establishment. But one aspect of food safety that is just as important are allergens. Now, if your staff is not or are not properly educated or trained on allergens, it risks a customer having a life-threatening allergic reaction and needing medical attention. Or being knowledgeable about allergens helps to minimize the risk of exposure to customers, as well as the risk of someone suing your restaurant or your staff. Now, therefore, it is your responsibility to prevent this kind of situation from happening. So protect your customers and your business by having your staff allergen trained. That's why this type of training is important for the success of your business. So if you need more information of food allergy and intolerance, please, you can visit the Food Standard Agency website. Okay, so our first module will be effect that allergies have in the body. Now, the introduction: an increasing number of people need to avoid eating certain types of food because they are allergic or intolerant to the food. The module will explain the types of symptoms people with food hypersensitivity may experience. These vary from mild symptoms to life-threatening emergencies such as anaphylaxis. Now, after working through this module, you'll be able to understand the risk of someone with the food hypersensitivity ingesting food which may cause a reaction. And you'll be able to explain the difference between a food allergy, a food intolerance, and a coeliac disease. And you'll be able to understand what to do if someone has anaphylaxis. Now, food hypersensitivity, what is it? The term food hypersensitivity is used to describe people who experience an adverse physical reaction to food which is otherwise harmless. Remember, this includes the conditions of food allergy, food intolerance, and coeliac disease. So, what is the cause of food allergy? A food allergy is when the body's immune system, which is the body's defense against infection, mistakenly treat the protein in food as a threat. So the body responds to this threat by releasing a number of chemicals in the body. Now, these chemicals cause the symptoms of an allergic reaction. Now, people with a food allergy can react differently when they are exposed to allergens. The type, the severity of the reaction depends on a number of factors, including the individual, the severity of their allergy, the amount of allergen they have been exposed to, other factors such as exercise, lack of sleep, or medication, which can increase also an individual's sensitivity. Very small amount of allergens can cause severe adverse reactions. So the most severe and potentially life-threatening reaction to an allergen is anaphylaxis. Now, what are the symptoms? The most common symptoms of an allergic reaction include tingling or itching in the mouth, a raised itchy red rash. In some cases, the skin can turn red and itchy, but without a raised rash. The swelling of the face, mouth, throat, or other areas of the body. Difficulty swallowing, wheezing, or shortness of breath could be one of the symptoms. Feeling dizzy and lightheaded, feeling sick, nausea, or vomiting, abnormal pain or diarrhea, hay fever, like symptoms such as sneezing or itchy eyes, allergic conjunctivitis. The food hypersensitivities still. Now, food allergies are divided into three types depending on symptoms and when they occur. Number one, we have the IgE mediated food allergy. Now, this type of allergy is the most common. It is triggered by the immune system producing an antibody called immunoglobulin IgE. Now, the symptoms can appear from minutes up to 2 hours after eating the allergen. There is a greater risk of anaphylaxis with this type of allergy. And the second one is the non-IgE mediated food allergy. Now, this allergy is often difficult to diagnose as symptoms take much longer to show, up to several hours. It is not caused by IgE antibodies, but by other components of the immune system. And the third one is mixed IgE and non-IgE mediated food allergies. Some people may experience symptoms from both types of allergies. This is known as mixed IgE and non-IgE mediated food allergies. Now, let's speak about food intolerance. What is the cause? A food intolerance is more common than a food allergy. Food intolerances are thought to affect 1 in 10 people. Food intolerance do not involve, remember, the immune system. Instead, a food intolerance involves the digestive system and can cause difficulty digesting certain food, leading to symptoms such as abdominal pain, gas, and diarrhea. Now, those who are affected often rely on allergen labeling to avoid the food that make them sick. Now, what are the symptoms of food intolerance? In general, people who have a food intolerance tend to experience tummy pain, bloating, wind, and diarrhea, skin rashes, and itching. Now, what reactions caused by a food intolerance are not life-threatening, the effect can take a long time to resolve, sometimes lasting for days or weeks. When managing food safety within their business, the food owners need to treat allergies and intolerances equally as consumers react to different levels of food. Now let's speak about the coeliac disease. What is the cause of coeliac disease? Now this disease is a serious autoimmune condition triggered by consuming gluten, which lead to damage of the gut lining. Now this has a severe impact on a person's ability to absorb nutrient from food. Gluten are proteins found in wheat, oat, spelt, and kamut. Now, what are the symptoms of coeliac disease? The symptoms of this disease can range from mild to severe and include bloating, diarrhea, nausea, wind, tiredness, constipation, anemia, mouth ulcers, headaches, weight loss, hair loss, skin problem, short stature, depression, infertility, and also joint or bone pain. Some symptoms may be confused with irritable bowel syndrome, IBS, or gluten intolerance, while other symptoms may be related to stress or aging. Therefore, it can be difficult to get an accurate diagnosis. Following a gluten-free diet can stop the symptoms. It is important to note that allergies to specific cereals such as wheat should not be confused with a gluten intolerance or coeliac disease, as the proteins responsible for triggering an adverse physical reaction are different for food allergy and thus should be considered separately. The cereals containing gluten in a gluten-free product will have significantly lowered levels of gluten, sometimes 20 parts per million or less. However, the product will still contain the cereal specific allergens such as wheat and barley. Therefore, such a product will be safe to eat for a consumer with a gluten intolerance or coeliac disease, but not for a consumer with allergies to the specific cereal used in the product. For example, a gluten-free beer which used wheat as an ingredient will be safe to consume for a consumer who has coeliac disease, but not for a consumer who is allergic to wheat. Does it make sense? Let's speak now about anaphylaxis. What is the cause of it? Someone who has a food allergy can go into anaphylactic shock when their body's immune system mistakenly treat the protein in food as a threat. Now, what are the symptoms? Anaphylaxis is a potentially life-threatening allergic reaction. The symptoms of anaphylaxis include persistent cough, in the vocal changes, breathing difficulties such as fast, shallow breathing, wheezing, a fast heartbeat, feeling light-headed or faint, confusion and anxiety, a clammy skin, collapsing or losing consciousness. Now, there may also be other symptoms including an itchy, raised rash, feeling of being sick, swelling, or stomach pain. Now, what to do if someone has anaphylaxis? If someone has symptoms of anaphylaxis, the NHS advises that you should use an adrenaline auto-injector if the person has one, but make sure you know how to use it correctly first. Call 999 if an ambulance immediately. Even if they start to feel better, mention that you think the person has anaphylaxis. Remove any trigger if possible. Lie the person down flat unless they are unconscious, pregnant, or having breathing difficulties. Give another injection after 5 to 15 minutes if the symptoms do not improve and the second auto-injector is available. So next we're gonna go to our knowledge check, and I believe that you have enjoyed the first module in this course, so we're gonna go to the knowledge check next. Okay, now we are going to be doing a knowledge check. There will be 3 questions just to check your knowledge if you have understood everything that we have covered in this module. So the first question will be the term food hypersensitivity is used to describe. So you have to select the correct answer. So the term food hypersensitivity is used to describe a condition that can cause the intestines to swell, or B, a condition that results in persistent coughing, and C, a serious autoimmune condition triggered by consuming gluten, and D, people who experience an adverse physical reaction to food which is otherwise harmless. So you've got to make sure you choose the correct answer. I go to the second question. A food intolerance is more common than a food allergy. Is it false or true? A food intolerance is more common than a food allergy. Is it false or true? So you choose the correct answer. And the last one, the most common symptoms of an allergic reaction include A, inflammation of the joint, abscess, wheezing or shortness of breath, and the last one, severe nose bleeding. So the most common symptoms of an allergic reaction include inflammation of the joint, an abscess, wheezing or shortness of breath, severe nose bleeding. So you choose the correct answer. So when you finish, you'll find the correct answers and you'll be able to send it to us. At the bottom of this module, there is a link that you can send your answers. Okay, thank you very much, and I will see you in our next module, module 2.